Good morning. Happy New Year. Yay, it's 2020. I know. 2020 is going to be much better than 2019. So, we are going to kick off this year with Grand Rounds. Dr. Bahna is talking about severe food allergies without eating. If I went through a proper introduction, we'd still be here at noon and he would not have a chance to talk yet. So, we're going to just say, here's Dr. Bahna, world expert on allergies, and let him take it away.
Thanks. Thank you. Well, thank you for coming so early. And I see that there are distinguished guests here, dressed very formally in black. If I knew that you are here, I would have borrowed or rented a tuxedo. Well, it may sound strange to you to have a title like that. In medicine in general, the history is the most important. Every doctor has to take a history. And not every person takes a history is a history. The person who takes a thorough, skillful history is ahead of any laboratory. Laboratory is to serve us, not to control us. So in allergy immunology in particular, the history in itself, often without a lab, we can reach a good diagnosis. So I hope I emphasize for you in this presentation the importance of a skillful history. So the objectives of this presentation recognize non-ingestant routes. Because in the history, we always say, what did you do before you got this symptom? Well, I was exposed to heavy gases, for example, or chemical. Oh, that's what caused you having cough or pneumonia. I was exposed to whatever agent. I took a medicine and I got a rash. So we link it. And I was eating, and even before I finished eating, I got a rash all over. I was going to die. So we link it to the food. What did you eat? But how about if the person said, I didn't eat? We usually just exclude the whole category of food allergy. He said, I was not eating. It happened many times. I was not eating. The other objective is suspect food allergy, even though the reaction was not preceded by foods, and realizing that a thorough history taking can be the most important in reaching a diagnosis. Some of the presentation that I mentioned today, and most of it is cases, either from me or cases that have been reported in literature, make us raise eyebrows. I can't believe it. I never heard or read about that. And therefore, I don't believe it. Thinking that all the knowledge is already in our head, and whatever doesn't fit with it, I don't believe it. I didn't read it in a book either. So I would not be surprised that you say, this doesn't make sense. Bear with me. We already locked the doors in the front, and we are going to lock the doors in the back also so that nobody leaves. This is a part of a letter that came to me. People find my emails, I don't know how. I grabbed a handful of mixed nuts from a can, and immediately my throat felt like it was burning and itching. Within a few minutes, my tongue began to swell. I started having difficulty swallowing, and my entire body was itching horribly. My friend rushed me to the emergency department. I received several medications, IV, and the reaction resolved. She did not eat anything, this lady, but she's going to die. So how it happened? She just held things in her hand. She also smelled something. So there must be some other sources that the food allergen can go into the body. So skin contact, mucosal contact, inhalation, transplacental, injection, transplantation, and I will give examples of each of these. There are many examples, but we will not have time for all that. So we will go first by skin contact. This large study from Spain, almost 200 fish allergic children, 15% of them showed symptoms upon skin contact with the fish. Reactions appeared within a few minutes and disappeared within a few hours. Any allergy, if you are avoiding, it will disappear. But if it was injectable allergen, it can last for a long time. Reactions appeared within a few minutes, that's it. The age at onset in these children by ingestion of the fish was earlier than by skin contact. That's usually by ingestion starts first. Another important finding that 60% of them have atopic dermatitis, have disrupted fins. The skin is not healthy. 60% of the reaction occurred even by indirect contact, meaning the person even did not touch it. But a napkin by somebody at the table used to wipe fish in the fingers, and the other person used it, or the fork dipped in the fish, dipped in the chicken, or the fingers. The parent just held the child, was crying, and that touch did it. And 20% of them even by raw fish. Heating fish, heating allergen can change it, can make it less allergenic or more allergenic. And depending on the type of heating, roasting different from boiling, preservative change. So we cannot say a food is a food unless we know at what form was it served. Was it raw or cooked? And can go both ways. The best example that you are aware of, roasted peanut, much more allergenic than raw peanut, than boiled peanuts. So in the United States, we have more peanut allergy than in the Far East because they boil it. The allergenicity changed. So don't be surprised when a person say, I eat a tomato. Fresh is okay. But when it is heated or cooked, it's not okay. And we tend to say, it does not make sense because heat is supposed to change the allergen. Or it can change it either way. The manifestations in those 29 children by touching, urticaria and angioedema, 86%. Local itching and erythema, that's simple, but 10% only. In that site and the location when they touched. But amazingly, one of these 29 had wheezing, means systemic reaction. Although touching was in the skin only. The respiratory tract reacted. Another series, 40 children, mostly very young, with localized urticaria or rash upon contact with milk or egg. 85% of them had atopic dermatitis. Again, 38% have GI and 20% have asthma. Asthma is another factor. Half of them of the atopic dermatitis cases were exacerbated by food contact. Skin application of the food on it was positive in almost 40%. 40 of them means 95% of them. It is obvious from the history, but it is good to verify it. And sometimes we generalize urticaria, even just putting a piece of food carefully in front of you on the child's skin and it's going to cause generalized urticaria. This is an interesting case. The baby breastfed, which is very commendable practice, exclusively with nothing else for 5 months, and continued for 18 months with the addition of other foods. There's a strong family history of allergy. The genetic factor is important. At 5 months of age, had anaphylaxis from few milliliters of milk formula. Just started to introduce the milk formula. After 1 month, got urticaria to egg, soy, and peanuts. Highly allergic child. When I start to see that child at the 17 months of age, the IgE was much higher than expected. The specific IgE in the blood, sometimes when we find a person highly allergic to touch that degrees, we refrain from doing skin testing even. We'll go to the blood test. Although skin test is better, but will be risky in such selected patients. Was very strongly positive to the milk and the egg. Well, I reassured the family that milk allergy and egg allergy are much better to be outgrown than peanuts, tree nuts, and fish. So I said, we expect within a year or so, a good chance will be outgrowing by strict avoidance. Well, at 4 years, that's a long time, between 17 months and 4 years, they came for a follow-up, got urticaria and the upper respiratory symptoms while in a bathtub, into which a few drops of milk were spilled by a younger brother. This part was not volunteered in the history, but we worked as detective. Why would a child in a bathtub not eating and get urticaria? So we have to think of other things. Could it be the temperature of the water? Could it be rubbing the skin? Because some patients have dermographism. Could it be mastocytosis, skin mastocytosis? You rub it and the mast cells are loaded with histamine and tryptase and will go up. No, but my thing says, what happened? What happened? He said, the other child, the sibling, the older sibling, was around, standing on top, drinking from a cup with a hole, drinking milk, and some drops of milk came into the water of the tub. Then we said, oh, it doesn't make sense. Right? You agree with me? Yeah. Do you agree with me? No, that makes sense. That's why I'm standing here. It makes sense. When a person is infected by a virus, do you see it? Do you see it by even regular microscope? And when you see it by electron microscope, what do you see? A little blood dot? Do you know that this virus can destroy and kill thousands? Yes, we have no problem in that. So sometimes the immune system reacts vigorously against an innocent agent. Another case, a 15-month-old boy, breastfed again. It's wonderful when I see these cases. So that started with breastfeeding, 3 months, total 9 months. His mother ate a lot of peanuts during pregnancy and lactation, so that may be a factor being considered. We'll come to it later. Strong family history, genetic factor. At 2 months, developed atopic dermatitis that later was noted to be exacerbated by tomato and possibly they suspected milk and crab. I don't know why they are giving crab to at 2 months, but it is Louisiana. At 1 year, had facial angioedema after rubbing his face with his hand that was just contaminated with peanut butter from another child's hand. Look at the steps. Very indirect exposure. Well, at 15 months, IgE was high, about double what's expected. The specific IgE in the serum was positive. A skin prick test was positive to the egg and to some degree tomato. The challenge was positive to half hard-boiled egg white. He refused tomato challenge because of a strong history, which if things are very clear, You don't have to prove it and endanger the child with severe reaction. And this case was reported from Canada. 2 school children had urticaria and angioedema to peanuts. Strictly avoiding peanuts. Experienced recurrences of facial urticaria and angioedema only while playing basketball. Well, the coach said, hey, guys, whoever in the team ate peanut butter, please wash your hands very well, and we wash the ball very well before we play. These 2 children didn't get it anymore. Work as police detectives. 2 cases of anaphylaxis, not just a simple reaction. One of them was known to have milk allergy. And the mother was very strict in avoiding milk. She got the child to the emergency room, and anaphylaxis. They asked her, what did you give him? She said, I did give nothing. He's allergic to milk, but I am not giving any milk. Well, you must give without you knowing, must be hidden in something else. Well, anyway, the child was resuscitated, and for fear of a second phase anaphylaxis, was admitted to the hospital, a very good practice. But the child didn't get any problem, so the next day told her, all right, your child now is like a rose, take him home. Well, prepare him home, and anaphylaxis happened. What did you do? I was just preparing him to take home. I was putting this cream on the diaper area. Is this what you did yesterday? Oh, yes. Oh, what is in that cream? Look at the tube, cod liver oil, zinc oxide. There is no milk, whey, or casein in this label. So what is it? Yes. Look at the paper box. Who keeps the paper box? And you find written calcium caseinate. But who keeps that? Once you buy that, open, throw it. See how you check. And sometimes patients look at us, we are asking silly, stupid questions. They don't realize it can help us. They just wanted to come and we do a test or MRI and discover the peanut in the MRI there or the egg there. But the history, good history, make us find out that and say, let's look at, get that box or go look online and read what are the ingredients, because here the discrepancy. The label is complete on the outside and the tube that she has in her hand doesn't show that. How much casein is there? That's the components of that cream. Many components has calcium casein, 5% of all this. And how much are you putting anyway? On the other hand, another diaper cream did not have any food protein. This is a small quantity again, but it happened that the diaper area was inflamed. Therefore, absorption will be greater. Severe food allergy by skin contact, we put 5 cases, had severe food allergy reaction to trivial skin contact. And by inhalation, 1. Again, breastfeeding well. Family history strong. Early age of onset having the allergies. Very high total IgE, the measure, the thermometer for atopy in general. A strong positive reactivity to foods by skin test and specific IgE. The offending foods were by ingestion milk, egg, peanuts, and one of each of the others. By inhalation, 1, peanuts and shrimp. By skin contact, milk and peanuts. By kissing, if the mother ate that or a sibling ate that and kissed the child, 2 of them. Another interesting case, a 6-year-old boy with allergic rhinitis, various aeroallergens, and intolerance to milk and soy, had anaphylaxis on eating egg, fish, or seafood, or even inhalation of cooked fish. You can imagine how some of these children are miserable, how their families are burdened by this. Although we use the word allergy so loosely, it's not cancer. Well, I would rather die from cancer or a gunshot than from a peanut. I'm worth more than a peanut, for heaven's sake. Peanut kills me now. I want somebody shoots me or cancer kills me. That's, I'm proud of myself. I'm a hero. And the obituary will be written, he battled the cancer for so many years. Oh, the word battling, that's good. But battling a peanut? No. So, urticaria on touching egg or shrimp. One episode occurred in a fishing trip. That boy he's a Louisiana boy, liked to go with his father for fishing. He enjoyed that. There is no psychological component. But once the fresh fish comes out, he gets itching. Another while in a room next to the kitchen, and he didn't know that his mother is cooking with eggs. He got also an episode of urticaria. No psychological component in this. Serum Ig is very high. When I do skin testing to see patients, either I avoid it or, and instead of using 1 in 10 extracts, I dilute it to 1 in 1,000 to 2,000, so that I don't induce a severe reaction. A 9-month-old breastfed, I'm showing you cases, although some colleagues, nationally, internationally, tell me, we like to at you present large series, not one at a time. I said, what do you do in your daily practice? Do you see 20 persons in one room right away? Or you see one patient at a time? Did these patients come in the same way? No. Did they read the book? No. So you have to understand as clinicians, you don't take the average of a series. What does average have to do to your single patient? Or 95% reliability. Well, your patient may be in the 5%. Individualized medicine, whether in diagnosis or in treatment, is the fashion now. So at 1 month, developed atopic dermatitis. At 3 months, localized urticaria following kiss by his mother, who just ate cereal with milk. At 9 months, generalized urticaria when he was touched by his brother, who just ate a peanut butter sandwich. And the evaluation supported these things. The definitive diagnosis or proof is by challenge, gradual, cautious exposure. And you find half a teaspoon meringue, a very little egg white, and 1/8 of a slice of bread reacted to both of them. Of course, we did not challenge with milk and peanuts with that strong history. This is just one table of many in the lecture to show that infants reacted to topical things. We like to put a lot of things on the skins. Oh, yeah, we think the skin will be better, but not realizing while we are beautifying or soothing the skin, we are adding allergens to them. Very fine. One of them had wheat, one had milk, peanut, and egg. And these things can sensitize and provoke reactions. The more in the ointment, the worse it is. We like to look at the list. Oh, look, that has a lot more than that. So get it. You are getting allergens with it as well. This is an interesting condition. Some of you may have experienced that certain fresh vegetables or fruit have furocoumarins, and you touch them, if you did not wash your hands quickly, it is there, and the exposure to the sun, it is a phototoxic contact dermatitis. And you find the hands, look at that. This is Hands of the lady was squeezing lime, did not wash her hands, and exposed to sunlight. Therefore, food allergy by touch can manifest as dermatologic or systemic reactions. Contact urticaria, angioedema, irritant contact dermatitis, phototoxic contact dermatitis, delayed reactions, allergic contact dermatitis, either local or systemic, and this is interesting condition. The allergists are aware of it. How we can say systemic contact dermatitis? The person is sensitized through the skin. And this is a delayed type reaction through the T cell, cell-mediated reaction. And the T cell can move around or can stay in a certain area. But the person eats the food that was sensitized through the skin and the food parts will go through that area where the T cells are there and will go. So I didn't touch it, but you ate it. So it's a strange term, systemic contact dermatitis. The action can be remote, like in respiratory tract, either in the upper, or big coughing, or bronchospasm, or angioedema in the larynx, or even multiple systems had anaphylaxis. The second route is mucosal contact other than the GI, the normal swallowing ingestion. So it can just the oral mucosa from kissing. There's no eating in here. Toothpaste or certain dental filling. We saw a lady yesterday who was referred for testing for local anesthetic because she got a reaction after the dentist did some work and she got angioedema and discomfort. I said, all right, we will test you with local anesthetics, but if they are negative, we have to suspect the other material that the dentist put to take the impression of your teeth. Nasal mucosa, medications. We look at topical things very lightly, whether they are on the skin or in the nose or in the eye. Nasal mucosa medication will give you the case for that. Conjunctival. Medications have some additives, some preservatives, stabilizers. Rectal mucosa, either suppositories or enema. Vaginal mucosa, lubricants, medications, or the semen of the partner has food in it. So far, good? Nobody leaving? Good, thank you. Milk kiss. This 6-month-old boy had anaphylaxis to milk multiple times. What a terrible thing. Milk is a good food. It's not germ. It's not dirt. At 6-12 months, have urticaria and GM to egg, peas, and lentils. Hi. Localized urticaria whenever was kissed by his sister if she just drank milk or ate ice cream. Oh, God, she loves you, man. But why is she doing that to me? At 17 months, when I saw him, has 871, very high IgE. Skin prick test was strongly positive to 11 foods. But, and this is a big but it challenged positive to only 3, emphasizing not every allergy test, whether it's skin or blood, equal allergy. It is equal sensitization. That I have Ig antibodies that may or may not be clinically relevant. So challenging of these 11 positive food by test, only 3 cause the reaction and the 8 no. This is not like a biopsy of a cancer or a strep throat. You proved it there, so we're going to treat. Of course, it was not done with milk because if just kissing, that little part remaining on the lips cause reaction in him. Again, when I said that milk allergy is one of the best that can be outgrown, but after several months, we challenged him with 3 drops of milk, because facial urticaria, sneezing, is anaphylaxis. 3 drops. You have to be extra cautious in doing this. And we cannot tell the parents, well, try it at home and let me know. What a tragedy every now and then if it happens that the person can die because they are going to give a quarter of a glass of milk. In a large series that was in a registry, and they did a telephone call to this. And in the registry, there was about 380. 20, that's 5% of the subjects with self-reported food allergy experienced reaction through kissing. They asked them by phone. This is self-reported, which is always more than reality. All the 20 subjects reported life-threatening reactions to food ingestion. Of course, that's terrible ingestion. 17 could be contacted. All had local reaction at the sight of kissing within less than a minute. 4 had wheezing. Why? Kiss followed by bronchospasm. Oh gosh, kiss of death or what? 1 had systemic anaphylaxis. 4 had reactions even after partners brushed teeth. What do you want us to do now? We knew and we brushed the teeth. The foods were 11 peanuts, 12 tree nuts, 1 fish, 1 pig. I may show you cases after brushing teeth and washing the mouth very well and waited a couple of hours before kissing. And the reaction happened. Anything comes in our gastrointestinal tract, part of it will be incompletely digested and will be absorbed and goes every part of the body and is excreted in every body fluid, including the saliva. So it is not you already brushed and cleaned that, but came from the circulation after a couple of hours. Comes in the semen after a couple of hours. And you see the most criminal, usually the peanuts and the tree nuts and the fish and the shellfish. The case from Italy, the nasal drops. A 20-month-old boy developed rhinorrhea, wheezing, and dysphonia. A few minutes after nasal decongestant drops were bought, containing some decongestant and antihistamine, and the preservative or stabilizer is lysozyme, a protein from the egg white. He was breastfed, and because of atopic dermatitis since 2 months, weaning was very gradual and the egg was not introduced into his diet. Skin prick tests and specific IgE are positive to the drug itself, to egg white and egg yolk of albumin, they investigate well, and the lysozyme. These things can be obtained. And a sophisticated test microarray demonstrated at the specific. When we eat a food, that food is not one protein. It be 20, 50 proteins. And some of them are more allergenics than the others. So GAL-D4 is the egg lysozyme, is one of the egg proteins, was positive by this sophisticated test. Of course, who blames the parents when they refuse? Please, we're going to throw away this nasal drops and don't tell us we prove it. This case from Switzerland, 7 patients repeatedly reacted to vaginal suppositories containing antibiotic and antifungal and lysozyme as a preservative. The reactions were systemic in 6 and local in 1. 3 patients reacted on the first exposure. We usually need prior exposure to cause sensitization. Then subsequent exposure, the allergen will react with its IgE antibody. But this lady said, this is the first time that I used this type of suppositories. Never used it before. but they were allergic to egg. Of 4 patients who had no history of egg sensitivity, 3 reacted on the 3rd or the 10th day. This meaning allowed a period of sensitization first. Then the allergen came ready, the match on the gasoline. Sexually transmitted allergy to Brazil nuts. 20-year-old woman with a history of recurrent angioedema after consuming foods containing nuts. The skin test was strongly positive to Brazil nut, but negative to many other nuts. Shortly after intercourse, developed local itching and swelling, widespread urticaria, and felt faint and mildly short of breath, systemic anaphylaxis. Her partner was aware of her allergy, so he bathed, brushed teeth, and cleaned nails immediately before the intercourse, as he had consumed mixed nuts 2-3 hours earlier. He did his job. So the investigator said, come on here. We're going to have a skin test with your semen without eating the Brazil nut, and another occasion after we eat Brazil nut. And sure enough, they found the protein in the semen. Wonderful. I assume that all of you, the first 2 rows, are going to apply for allergy fellowship. It's lovely. It's enjoyable. Oh, this is another case from Canada. Well, Dr. Susan Tarlo had a woman with chronic GI symptoms for 8 months. Mild asthma and other things. Past history of cat allergy. She's atopic. However, her main problem was gastrointestinal. So she went to various gastroenterologists, evaluating her why she had these abdominal problems. Well, they did of their evaluation barium enema. Oops, she was fine, got anaphylaxis on the table. Well, they suspected latex, but latex was not used at all in this procedure. Many hospitals now deleted the natural rubber latex, used synthetic gloves and other devices. Skin prick test was negative even to latex, but positive to the barium enema solution. But this has many components. So they called the manufacturer, said, can you help us, give us the components of this barium material? And they tested with each of the 13, only positive to the sodium carrageenan, which was present in 0.4% of the whole thing. Serum had carrageenan-specific IgE, specific skin prick test with commercial carrageenan gum extract was positive. Her chronic GI symptoms, that's the fortunate outcome. When she avoided the foods and the other product that has carrageenan, her original GI problem disappeared. Bahna. So the anaphylaxis was just a blessing in disguise. It's covered the problem. Third route is by smell. The same group in Spain who reported on the 197 fish allergic children by contact found 11% of the series also they react to the smell of fish, particularly when it is boiled or fried, so more particles in the air. The manifestations were respiratory, but also cutaneous, and both in some patients. 90% of them reported 3 or more such episodes. That's definite. Again, reactions by ingestion earlier than usually by the inhalation. Airborne exposure was while fish being fried or boiled or served just serve it to others. I used to have a colleague in another institution, professor. We were sitting at dinner in a restaurant. Her husband is next to her. He ordered fish. She said, "Can you please switch with me, come here in my place, that be away, to be next to her husband while he's eating fish," because she will react to that. A large series of patients, I think she found it doesn't make sense what I'm talking about. Although I said, yeah, can big bodies prevent people from leaving from back? We need two big bodies there and there. Large series of patients were evaluated for self-reported food allergy. They claimed the reaction to food without ingestion. 17% said that if I am standing in the kitchen, 13% while sitting beside a person who is eating the food, 12% when they were in close physical contact. 33-year-old farmer, it's an Italian guy, was in a farm, was on a milk-free diet because from childhood he had milk allergy. But while milking the sheep, he had severe difficulty in breathing and loss of consciousness. Full-blown anaphylaxis. Of course, he was resuscitated and was told, "You have a nervous disorder. You are crazy." What do you mean you are milking, you get this condition? This is a psychological, you need a psychiatrist. But after recurrence a lot, his friend who has asthma told them, "You look like me when I get an asthma attack." And I think volunteers, "Can you use this inhaler when you get that?" I said, yeah, feel better. So he was evaluated later on while he does not have any attack for asthma and found, yes, he has a mild bronchospasm without even exposure. So there is bronchial hyperreactivity, and the smell of milk, although it is raw, it is not boiled to be in the air much. 6-year-old boy had recurrent anaphylaxis. Well, let me move on. 10-year-old with mild intermittent asthma had a severe attack while in a room adjacent to the kitchen where hot dog is being boiled. Did not improve in albuterol, so he was taken to the emergency room where he was intubated and need to stay 4 days in the hospital. Past history, he had an asthma attack after exposure to hot dog before, particularly when it is boiled. And he had reaction to chicken also. The label of the hot dog listed the chicken, pork, and many others. Reading labels is very important. There are small quantities of things that the manufacturers like to be different from the other competitors. And they think it's small quantities, but they're not going to reveal it even, because that is the secret of the house. But this can cause troubles. 24-year-old woman had anaphylaxis to corn. Though attempting to avoid corn products, had multiple recurrences of anaphylaxis. She reacted to corn sugars and corn cellulose. These sugars and cellulose and oils have minute quantities. But still, those minute quantities, just imagine the analogy of a virus. It can cause trouble to exquisitely allergic person. Reacted when present near corn while being cooked, near corn chips, taking medication containing corn. Even the antihistamine, the treatment of the reaction. Benadryl has corn cellulose or fructose. Aspirin has corn starch, but tolerated. Antihistamines or aspirin from other sources that does not have corn, no problem. We heard a lot about banning peanuts from flights, and there are several airlines did that. And one flight attendant told me, we don't serve peanuts, but some passengers said, I'm allergic to gluten, I don't eat pretzels. I said, what are we going to do? Eating peanuts, I'm allergic to gluten. What? People are just too demanding. Don't eat the pretzels. But when you are given pretzels in a package like that, oh, they are so tempting. I need one more. But you get a large bag of pretzels, you leave it until it becomes stale and you don't touch it. But that's the thing, I like it. So, in a survey from a registry of peanut allergic persons, less than 1% of those claiming peanut in general reported a reaction from accidental exposure during commercial flight. Half of them have asthma. So atopic dermatitis is a risk factor for touch to the food, and asthma risk factor for by inhalation. 38% were first-time reactions. Medication flight was given to about half of them. And here, the mode of exposure by skin was much more than inhalation, ingestion. But if the person was already known to allergic, why he's tempted to eat it? Medications. An 8-year-old boy with severe milk allergy, avoiding milk, had asthma, was given a bronchodilator and an inhaled corticosteroids. He was switched to combined preparation to have, instead of having 2 medications, it is available in one. They're given that there without any problem for several months, but went to refill. And after the inhalation of 3 doses of the refill, got chest tightness. Well, they look at the label, and the label, and you find, and this is the label of the box, the paper box that the people will throw it away immediately. And it has lactose. Commercial lactose is derived from bovine milk, the sugar of the milk, not a pharmacopoeia type lactose to be free from milk protein. There are many medications have lactose, and these medications, unfortunately, for asthma. Look, many of them, some are labeled, the quantity, some they write small amounts, meaning what? Giving the impression that's a small amount. Can we say it's a small amount of virus? Don't worry about it. And some not indicated even. Atrovent, another, an anti-asthma medication, according to the package insert, Atrovent meter dose inhaler aerosol, but not the nebulization, has a label that contains lecithin. Lecithin is present in soy and egg, and is contraindicated by the manufacturer's instructions in patients allergic to soy or peanuts. However, a woman reacted to the nebulization that were not labeled. That is a contraindicated. Number 4 is, I will go quickly, that's, the remaining 1 hour only, fast, we'll finish quickly. That transplacental, just summarize the evidence for you. Prenatal sensitization has been proven by there's allergic reactions have occurred in young infant to the very first exposure to the food. And we used not to believe the mother, say you must have given without your knowledge. He cannot react from the first time. He did not have IgE antibody. So he must came down from the birth canal already sensitized to a certain food by transmission from the maternal circulation across the placenta. Well, another objective evidence, food-specific IgE was detected in sera from the umbilical cord or the newborn who didn't eat anything yet. So it's already the antibodies, and IgE does not cross the placenta. The only immunoglobulin that crosses the placenta is IgG only. So if there is IgE antibody in the umbilical cord or the newborn, the fetus made it. Detection of food allergens even in cord blood. However, fortunately, no reported evidence for prenatal allergic reaction in utero. God protected fetuses and babies. Oh, this is blurred, but this is about the relationship between the intake of certain foods during pregnancy and the odd ratio for food sensitization from sesame seed to tree nuts, peanuts, so forth. Most of them are crossing to the right of the line, means there is a relationship. Some of them are. So this somewhat controversial area. By injection, either the person is injected by medicine that has food protein or given blood product, particularly plasma, that has food protein or antibodies already manufactured by the donor. So just two cases, an 8-year-old girl with asthma, atopic dermatitis, milk allergy, presented to the emergency department with acute asthma, partial response to the beta agonist, was given, of course, steroids, solumedrol, 3/4 ml of 40 milligram per ml. There are two preparations of solumedrol, some of them 40 milligram per ml, and the other is 125 milligram per ml. But they are the same medicine by the same manufacturer. A 3-month-old boy presented to the emergency department with urticaria in the neck, did not improve after a dose of oral antihistamine, has history of allergy to milk and other foods. In the emergency department, they are good in giving right away steroids. A few spots of urticaria in the neck. And again, they gave the solumedrol, half ml of 40 milligram per ml, got generalized spread of urticaria. Well, usually we say, well, anything starts can peak. We blame it on the disease. The disease is going to peak. We're not thinking, I'm giving a steroid. That's the treatment of allergy. But evaluation. They were tested for 5 injectable corticosteroid preparations. They were positive. Both children were positive only to solumedrol 40 milligram per ml, but not to solumedrol 125 milligram per ml. Because the 40 milligram ml has lactose and beta-lactoglobulin, but not the 125 milligram. What is happening here? Telling me leave. Is somebody stopping it there? No, please put it back if you are. No? All right. I assume you are innocent. Where did we stop? Yes. All right. Quickly. Of course, we cannot leave this area without things in vaccines. Egg in vaccine. People are afraid of it. But actually, the MMR should be given without any fear. The rabies also without any fear. The yellow fever that needs skin testing, and the influenza vaccine is usually safe, but if there is a fear in a person who's highly allergic to it, we may just do skin testing or give half of the dose and we wait and we give the other half. Oh, and even diphtheria tetanus are prepared in medium containing casein, but it's present in nanograms quantities. Again, very small quantity and very rarely will cause a reaction. There were 8 patients reported anaphylaxis after these vaccines, but of course they were not challenged to prove it. but assuming that may be due to the casein. Propofol is a good drug. Propofol contains the lecithin, which I mentioned is present both in soy and egg. It's contraindicated in patients allergic to against soy. But some patients react to propofol not because of the medicine, but because of the lecithin. Or plasma transfusion. 8-year-old female without a history of any allergy received 2 units of frozen plasma. 2 hours later, she ate peanut butter, which she used to eat, and within minutes developed anaphylaxis that resolved after several hours. She received the plasma, and she ate peanut and got fired, meaning the peanut is the match. It must be the plasma has the gasoline, which is the antibody. 1 week later, total IgE is very low. She's not an atopic person. However, the specific IgE to peanut was elevated, and the skin test to peanut was strongly positive. Wait, 2 months later, IgE still low, had negative peanut, so it was positive first, became negative, meaning the antibody is gone. The IgE antibody's half-life is about 2.5 days. So Gradbach is out. A 6-year-old with ALL had anaphylaxis while receiving the blood, platelets in particular, and to always test any blood product for ABO/Rh. That's it. But there are more than 200 antigen for HLA. Tryptase level immediately after the reaction was 5 times expected. Had normal IgA and C for all that. No history of drug or latex allergy, but 5 years earlier had anaphylaxis to peanut, which has been avoided. So upon contacting the blood donors, 3 recalled eating large quantities of peanut the evening before donation. Okay. The food allergy through transplantation, mainly the bone marrow or solid organ, particularly the liver. Quickly, a woman with non-Hodgkin's lymphoma received bone marrow from her HLA identical brother who has multiple allergies. So we are making, by bone marrow, we are making new immune system completely. So pre-bone marrow transplant in that lady, the IgE was normal, and the specific IgE in the serum was negative to the food that caused the reaction after the bone marrow. And after transplantation, the IgE went 5 times, 6 times more, and was positive. So the person took the new bone marrow with its genetic allergy. Liver transplant. 22-year-old male with peanut allergy had anaphylaxis after eating sauce which contained peanut after coma. Let me jump this quickly, it was very interesting. This is the person who died from peanut allergy. They protruded the organs and they gave his pancreas and 1 kidney to a woman. And they gave the liver and the other kidney to a man. And later on, the man developed allergy to peanut that he was not allergic to before. But the woman did not get anything. Here is the man, peanut allergy, yes, she not. Specific IgE to peanuts was positive. Peripheral chimerism was present in the man, but not dominant. Chimerism meaning 2 cell lines, different. So has a successful bone marrow transplant. Good. The liver is a very hematopoietic organ, particularly in utero and in the young infants, but still have cells. So in conclusion, exquisite food allergies can occur through multiple routes other than ingestion. They can be provoked by very minute quantities. In addition to genetics, high-risk predisposing factor, eczema for contact, asthma for inhalation, skillful history taking is the cornerstone for suspecting and evaluating such cases. And thank you, and we are almost on time. That's it. With that, you can have any questions? Absolutely, absolutely. Dr. Pramanik, I'm coming to you. How can we live without? A question from you.
That was an excellent overview.
That's what I told you to say, yes.
Thank you for that. Two things. Number one, that nowadays the management is giving small quantities for peanut allergy to prevent subsequent severe reaction. Particularly, if you can kindly comment on that. And number two, since you're an epidemiologist, there are places which epidemiologically, for instance, Georgia, a lot of peanuts there, a lot of coastal places, fish hunting. Population-based studies there, because at the outset you said there is a difference in different parts of the world. So comment on that, if you can.
Right. Let us take the first one, because I didn't get the whole second part. First one, we're talking about two things. I'm talking about people who are allergic already. You're talking about prevention for that. We used to recommend postpone solid foods, and as an expert committees on the Academy of Pediatrics, we said breastfeeding as long as you can, preferably 3 to 6 months, and introduce the regular milk at 1, introduce egg at 2, and introduce peanuts at 3 or 4. This was just expert opinion. We said the babies cannot digest these foods, and they are not essential anyway, and they are bad allergens. Well, until one study from Israel said they are giving babies a snack early with peanuts in it, and the prevalence of peanut allergy is less than in England. The investigator who made that comparison and said, look, could it be by giving the food early we are building tolerance? A sound hypothesis. Because look how much food we are eating every day and how many varieties of food. How many of us are allergic to this? One fraction. So meaning, God created, we build tolerance. So he recommended early introduction. The word early introduction, remember, not before 4 months. Because the word when mentioned early means from birth. No, not before 4 months. Preferably 6 months to do this. This study is still being in the gray zone after it appeared to make a big, published in the New England Journal of Medicine and the newspapers, and the TV and all that. So we say still early means not before 4 months. This is to build the tolerance. But once the person is allergic to something, done. Of course, there are new things going to appear soon about desensitizing. So settle that issue. What's the other question briefly?
Epidemiological distribution of commonly eaten food, like fish or peanuts.
Yes.
In different zones.
Yes. Certainly. Studies came from Finland. Fish allergy is more common in children because they're eating a lot of fish at an early age. And this is, again, it's introducing everything early to build tolerance. So, of course, if I'm going to eat the food seasonally, is different from we have food, any food throughout the whole year. So the factor of exposure, duration, and quantity will be more stimulating to develop allergy. Yes, of course. Yes. So exposure factor. Yeah. Well, thank you very much.